Hello everyone, I'm Dr. Jose Muñiz. This is Maria, massage therapist, Roger, certified personal trainer. And we're part of the team here at Access Chiropractic that will help you recover from your injuries and your pains. Now in these next series of clips, I'm going to be showing you our most common protocol that we use to resolve some of the injuries and conditions that we see here at the clinic. And I'll be showing you that next. Okay everyone, we are now in one of my treatment rooms. I have a Leander table here, and this table can do a host of techniques from standard chiropractic adjustments, decompression, drop technique. I also do activator, just to name a few. But what I'm going to show you right now is one of the most common conditions I treat here and what that looks like. Okay, so it's called low back pain. Alright, so we're going to use Roger here, the trainer, and let me show you what the assessment of this looks like. Okay, so basically what I'm going to check is for alignment of the shoulder blades. And in this case, you know, Roger has a shoulder blade that's a little depressed on the right side. Then I'm going to check for pelvic heights. And again, the right side is slightly lower. So what that tells me is that, you know, his alignment is starting to look like the right side being the culprit for it. So another thing that we may see is when I check range of motion, the left side has good fluid range, and then when I go to check the right side, he has limited range, possibly with a spasm. If it's bad enough, it may even send pain down the leg. And these are some of the most common things I see with low back pain. Now, one of the first treatments I will do to correct this is to give these vertebrae on the right, and the left as well, an adjustment to bring them into better alignment, which will take pressure off the nerve, so they'll help eliminate that radiating pain. Then as well, it'll bring back normal movement, so it'll help eliminate that restriction in range of motion. So I'm going to show you what that adjustment looks like. Okay, Roger? Go ahead and lay onto your left hip. And this is a standard non-rotary low back technique. And again, what I'm going to do is I'm going to go ahead and extend his back right here. So go ahead and form an arch right there on my hand, the other way. Okay, and then I'm just going to give it a small thrust. There we go. And what I did there was that I adjusted it into extension. I'm going to go work on the other side. Okay, and make that arch, Roger. And release. And there you go. Okay, Roger, let's turn back to this side. Excuse me. And to confirm that I made a good adjustment, I'm going to recheck the findings that I found. So let's go back here, stand up, Roger, relax. And what I should see is that his shoulders evened out, pelvis evened out, and the restricted motion on the right is gone, and the radiating pain is gone. Now what may remain though is there may have been a sprain to the muscles down the leg. Very common with low back is they may sprain these muscles. And when the muscle sprains, it forms a knot at the side of the sprain. So I'm going to show you on the next clip is a common treatment we do for that. Okay everyone, in this clip we're going to show you a common treatment modality that we use for the trigger points or knots that form in the sprained muscles. And we're still on the topic of the low back injury with the hip rotator and the hamstring injury. That's a very common injury that occurs. And Maria is going to demonstrate some of the techniques she uses to release the trigger points. So what Maria is doing here is she's using a non-allergic gliding lotion, and she's looking for the trigger point in the muscle belly. Now she's adding a technique called myofascial release to the therapy, and it's very effective at releasing trigger points and knots. Again, it's called myofascial release. This is what it looks like. It's a specialized technique that massage therapists learn if they do advanced training, and that's more or less what it looks like. It may have some variety to it depending on what the injury is. Now next she's going to demonstrate how she would treat the hip. And so in this sample, she's treating the hip rotator. And again, she's using this pin and stretch technique, which is one of the myofascial release techniques that we use here. And it's a very well-known advanced therapy technique, very effective at releasing the knots. And it's not good to have knots in the muscles because the knot will prevent the muscle from stretching properly. And it'll also cause further injury because the muscle's so tight. And so that's one of the first things that I like to focus on, is getting rid of the knots in the muscles so we can bring back proper circulation of blood flow to the muscle, and we can bring back flexibility to the muscle. And Maria is demonstrating how she releases the muscles in the back. And she's just using a simple deep tissue, kind of like a cross friction technique here. And she's looking for a knot, and once she finds a knot, she'll apply pressure, basically get behind the knot and try to separate the fibers of the muscle fibers so that it can bring back proper blood flow so the nutrients get to the muscle, and also by separating the muscle fibers bring back flexibility, which helps restore function and prevents further injury, because a tight muscle will sprain very easily. Okay, so that's what that looks like. In the next clip, we'll be showing you how we restore functional strength and flexibility. Okay everyone, now we are in our gym. And here in the gym we do therapeutic exercise to fitness and sports training. Right now we're going to give you a sample again of the low back injury and the rehabilitation exercises that we would do for that, or the therapeutic exercise. So let's first, we're going to address the low back muscles. And here's a very common basic exercise called the lateral bend, where we utilize some dumbbells. And Roger's going to demonstrate this for us. And basically the goal here is to strengthen the muscles along the side of the low back. They help support the low back. So the stronger they are, the more likely that you're going to be able to tolerate the activities such as lifting things from the side. Okay? And that's a sample of one exercise we may choose. We do tailor the programs according to the person's need. Now we're going to give you a sample of a hamstring exercise and low back exercise that we like our patients to be able to perform. And this is called the hyperextension. And go ahead and cross your arms right now. Roger's going to go ahead and demonstrate this with just his body weight. And that's a good strength to have. But again, when we're talking about performance, athletic performance, it may be better for Roger to build him up to being able to add some weight to this movement and performing the movement so he can tolerate a heavier type of activity. And that's what we talk about tailoring our programs. We have to know what your final goal is in order to know what exactly you need. But we're just giving you samples of what we may do. Okay, and that's one movement. And now we're going to show you a movement that we would do for the posture, because the posture muscles, in order for them to be stimulated, you have to hold the posture while you're doing movement. So in this case, Roger's holding a standing posture while he's pulling on that weight. And that triggers all those little fine muscles along the spine that hold our posture. Other samples that we may have this person do, other exercises may be planking, side planking, some Pilates movements. And exercise has a lot of variety to it. And that's one thing that Roger's really good at, is the variety of that exercise, because movements have a lot of variety. You don't just move in one plane, you move in multiple planes, so we want to work all those planes. So we're going to bring Maria back here, and I'm just going to close up here. But just in a nutshell, that's a common treatment plan that we follow for a low back injury. But besides treatment, one of our goals is to get you back to your overall goals. And that's one thing that Roger may do. You can talk with Roger, and you may have fitness goals, you may have sports goals, you may have goals of working at a higher intensity, and he's really good at forming exercise programs to bring you up to that level. And besides the therapeutic massage, Maria also offers massages of a longer time, like an hour, full body massages. She knows various techniques, from relaxation techniques to the therapeutic techniques we demonstrated over there. And you know, we want to be the place that you can come to when you have an injury and you want to recover from it, but you also want to get back to your normal living or get back to your fitness goals. That's what we're here for. And I'm producing these videos for that reason too, so that you can have a reference to look at. We have a YouTube channel. It's Access Chiropractic El Paso. We have a Facebook channel that also has a lot of videos and advice on there, and that's Access Chiropractic El Paso, you know, Facebook. We have our web page, which is El Paso, Texas Chiropractic.com. And of course our phone number, which is on the screen right there. You can call us, you can talk to David, he's our office administrator, or Dee, she does office administration as well. And we would be glad to help you with anything that we can, and we're here for you. And come by, say hello, have a great day.